Welcome back. Well, COVID-19 infection numbers in the country continues to rise. In the last 24 hours, over 3,000 new cases have been identified. Gauteng is the epicentre, reporting the highest number of infections. Let's discuss this matter now with Adrian Puren from the National Institute of Communicable Diseases. Thank you so much, Adrian, for your time this morning. Can you just talk to us a little bit about to what exactly could we be attributing this sudden spike in the COVID-19 numbers, particularly focusing on Gauteng, having about 80% or so of the numbers coming from there?
Yeah, so we've seen this, what we call the heterogeneity of the, I suppose, the resurgences, and this particular event is certainly taking place in Gauteng. I think there's been multiple sources of information in terms of guiding us with regard to focusing on the new variant that has been identified and has been declared as a variant of concern. And that has been, for example, the laboratory-based data that certainly showed an uncharacteristic nature of the PCR, as well as the fact that there's been a very dramatic rise in the numbers, in particular in Gauteng and in younger age groups. And I think that those pieces of information certainly has led us to at least propose that this new variant has actually is the major cause for what we are currently seeing. I think that that's been one of the major concerns. As you know, the models have been developed and certainly showed pictures that at least indicated in the absence of a variant that we should see a lesser resurgence. However, in the presence of a new variant, that those particular pictures certainly change, and that's obviously implications for us in terms of how we manage the next resurgence.
Well, we've seen as well, Adrian, in terms of those numbers, they've been escalating for the past 2 weeks or so. So it leaves a question, how long have we known about this variant, or when was this variant actually discovered? And when was it made public?
Yes, so in fact, the variant was only recently identified in terms of the, as I said, the PCR, what we call the dropouts, and that was noticed in the private sector laboratories. This was then sequenced. So there's been a very rapid turnaround in terms of identifying this particular variant. You're quite right. We will have to do some work, and I think some people have already started to model this. It may have been in circulation longer. Where it has been in circulation from the start is not always unclear. But I think the other implication, at least so far, is that we certainly have seen a dramatic rise in the numbers over the last few weeks. However, we've not seen a concomitant increase in terms of hospitalizations, at least in Gauteng thus far. So I think that's a good sign. But nevertheless, this is important in terms of planning, in terms of hospital readiness, oxygen capacity, ICU bed capacity, and so forth. These are areas that are of great concern, as you know, from previous resurgences. And it also comes back to the fact that, again, we need to emphasize how do we manage this as a community in terms of the non-pharmaceutical interventions, and then more importantly, getting people vaccinated will really be critical.
I mean, as you're speaking about how this is about management and containing the spread of the virus right now, but could we likely be suffering from the remnants of the local government elections? Because when the local government elections were held, we saw about 120 cases, 150 cases, and in some instances 300 cases or so. Shortly afterwards, we saw a spike in the number of infections. Are we reaping the results of the local government elections as well as the subsequent campaigns that were involved, which obviously then allowed for more human interaction?
It's a difficult one. I think, again, why would Gauteng be specific in terms of that particular outbreak? My sense would be that we would then see outbreaks in other provinces. It's possible that we will see that, but I don't think that we can purely ascribe to what we're seeing now to the previous election processes at all. I think it'll be a very difficult one to pin on that specifically.
Difficult as it may, but how's it then we try to contain it, especially when it comes to vaccination? Vaccination, unfortunately, in South Africa is quite low. In many instances, government reporting that we've got an oversupply of vaccines, and at the back of it, we've got vaccines that may be expiring soon. So in your expert opinion, what needs to be done to up the ante when it comes to our vaccination take?
Yeah, so again, I think it's the reprioritizing. I think making people aware that we now do have a variant, and this variant is very different from previous variants. It's really, when you look at what they call the phylogenetic tree, it really stands out in terms of the mutations that have arisen. So again, I know that there's still much to be learnt about this particular variant in terms of the vaccine responses, in terms of pathogenicity and transmissibility. But nevertheless, I think, again, this gives us an opportunity. This is not about scaremongering. This is about people who are in specific age groups, 50 and above or 60 and above, people with comorbidities, people that are immunocompromised. This provides us with an opportunity, again, to urge those particular individuals to really get vaccinated. Because I think, again, we've seen the effectiveness of vaccines in terms of other countries, that in fact you will certainly experience large numbers of infections, but in terms of protecting yourself against being hospitalized and dying, the vaccines are the one primary intervention that we really need to encourage. So to overcome this hesitancy, the fear, I think, again, we need to redouble our efforts in terms of reassuring people. Try and find the information that you need. What is it that you're worried or concerned about that prevents you from being vaccinated? And I think that's what we need to address.
Adrian, now, when we're looking at the variant, as you're saying, that there's a lot that we don't actually know about Omicron. So in that instance, do we know if it is indeed effective against the current administration of the vaccines? Is it effective, or is Pfizer vaccine or the Johnson & Johnson vaccine, is it effective against the Omicron variant? Do we know that as yet, or that's still yet to be determined?
So you're quite right. So there are a number of mutations that are of concern with regard to vaccine effectiveness. However, I think we have seen that the vaccines, even though we have multiple mutations, we've certainly seen that the vaccines have remained effective. If you look at Delta as a good example, that it is certainly protective. So my sense is that we may see a certain decrease in the effectiveness, but overall, my sense would be that there would be protection, and that protection will probably allow for people not being hospitalized and dying. But I think that information will certainly come out in the next few weeks, both from the laboratory side as well as from the epidemiological side, because we have systems in place to monitor people who are entering into hospitals who've been identified as being COVID-19 infected, in terms of who's been vaccinated and not vaccinated, in terms of giving us a sense of whether or not the vaccine certainly works.
Adrian Puren, we thank you very much for your time this morning, for joining us. It's from the National Institute of Communicable Diseases.